4 billion people worldwide have parasitic infection, and many parasites can persist, living inside the body for years without obvious symptoms. If you have unexplained bloating, constant fatigue, or skin problems, this may already involve you. If you feel tired despite good sleep and get hungry again shortly after eating, pay attention. The problem is that most parasites does not cause pain. Instead, they create chronic, slow nutrient loss. In the next minute, I will explain what actually works, what is myth, and what can be dangerous, and how to clean your body from parasites naturally and as safely and realistically as possible. When we say parasite in everyday language, we usually mean intestinal worms like ascaris, pinworms, hookworms, and tapeworms. They are different species, but together they account about 80% of human worm infection worldwide. The most common signs of infection is bloating and abdominal discomfort, belly swelling after meals, pressure, fullness, and gas. This happens because worms physically interfere with digestion. The second most common sign is unexplained fatigue or low energy, feeling tired even after sleep, weakness without clear reason, reduced stamina. It happens because parasites steal micronutrients, iron, vitamin B, and protein, forcing the body constantly compensate. The third important sign is increased hunger or unusual craving. Hunger shortly after eating, or strong sugar and carbohydrate cravings. Sometimes weight loss also occurs, sometimes anemia or iron deficiency, signs like pale skin, shortness of breath, or cold hands and feet. Skin reaction may appear to unexplained itching, especially anal itching, which is classic for pinworms. Sleep disturbance is also possible, like night restless, or waking during the night, or teeth grinding, or fragmented sleep. It happens because parasite increases nighttime immune reaction and nervous system activity. And remember, sometimes worm infection cause no symptoms at all, and it happens in nearly 50% of cases. People may feel absolutely nothing. Most parasitic infection happens because of food, raw or undercooked products, unwashed vegetables and fruits, or insufficiently cooked meat and fish. Usually, this type of infection is almost never dramatic. It is slow, accidental, and repetitive. And remember, heat kills parasites. Proper washing and through cooking breaks the cycle. Poor hygiene also plays a major role. It's extremely common in children, in people who bite their nails or eat without washing their hands. Soil exposure also important factor, like gardening, contact with dirt, and walking barefoot. This is classic for roundworms and hookworms. Pets, dogs and cats can also be involved, not directly, but because they can carry parasite egg from soil and feces, and then hand-to-mouth transfer can occur. That's why sleeping with pet can be risky, and not washing hands after contact increase the chance of infection. Now let's say about natural home remedies. The first and most natural remedy against parasite is a combination of garlic, pumpkin seed, and olive oil. Garlic should be crushed or finely chopped, about 2 medium cloves. Crushing is important because it activates the main compound called allicin. After crushing, you should wait at least 10 minutes. Cooking or swallowing whole garlic significantly reduces allicin formation. Pumpkin seeds should be around 40 grams shelled. Roughly it's 2 tablespoons. They must be raw and unsalted, slightly ground or very well chewed. Grinding releases cucurbitacin, a compound that paralyzes worms and can reduce the attachment to the intestinal wall. Add extra virgin oil, 1 tablespoon. Mix everything until you get a thick paste or spread. If needed, you can add a little more olive oil and mix again, and take entire mixture once daily, together with main meal, preferably in the morning or midday. Together, this combination may reduce parasite burden by around 60%. If the infection is severe, or highly symptomatic, the mixture alone is not enough and medication is required. But in mild cases, it can be important and supportive method. Recommended course is 3 weeks, around 21 days daily. You should avoid this mixture if you have active gastric or duodenal ulcer, because garlic can cause irritation of the stomach, pregnancy, or use of anticoagulant medications, or severe gallbladder disease. Along with this antiparasitic support, this combination also provides additional benefits like cardiovascular protection, gut microbiome support, and mild anti-inflammatory effects. The second effective formula is garlic plus pineapple plus yogurt and extra virgin olive oil. Garlic to medium clove, fresh pineapple around 200 grams. It must be fresh, not canned. Full fat yogurt or kefir 150 grams, and add extra virgin olive oil 1 tablespoon. Garlic should be crushed or finely chopped. Wait for 10 minutes and then mix everything together. You should get smooth edible mixture. Take once daily, preferably with meal, in the morning or midday. Don't intake on empty stomach because it may cause gastric irritation. Garlic damages parasites and inhibits their metabolism. Pineapple contains bromelain, the main active enzyme. Bromelain breaks down parasite surface proteins, reduces attachment to the intestinal wall, and imparts parasitic defense structures. And this enzyme is not toxic to the body. Yogurt or kefir helps restore normal gut microbiome and support beneficial bacteria and reduce risk of reinfection. And olive oil prolongs intestinal contact time, enhances absorption of active compounds, and supports bile flow, which is important for parasite clearance. If a parasitic infection is more serious and parasites are physically observed and visible, often visible, clearly detected, then stronger treatment is needed. That's why medications exist, because when there are significant symptoms, persistent abdominal pain, ongoing diarrhea, anemia, or weight loss, this can also affect children's growth and development. This means that person has true parasitic infection, not just colonization, and it's more serious. That's why high-risk group like children, immunocompromised individuals, and elderly require more intensive treatments. For this, medication is used. Or if symptoms persist after 4 weeks of supportive care, medication is still required at this case. And most commonly used prescribed medication is albendazole. Albendazole is effective against roundworms, pinworms, hookworms, and some tapeworms. It blocks glucose uptake by the parasites and starving it of energy, leading to gradual death and detachment of parasite. And usual dosage is 400 milligrams, a single dose, or 400 milligrams once daily for 3 days. For pinworms, a single dose is usually enough. Also, repeating dose is commonly required on day 14. Its effectiveness is close to 90%. Albendazole should be always used with food because fat significantly improves absorption. Temporary side effects may occur, such as mild abdominal discomfort or nausea. Mebendazole is similar to albendazole. It's second important medication, but it looks like to albendazole. It's same, belongs to the same drug class, and it's effective against pinworms, roundworms, and hookworms. And 100 milligrams twice daily for 3 days is effective, and single dose and repeated after 14 days.